timely intervention. So in healthcare, it's not only what we do that matters, but when we do it.
What are the strategies for timely intervention?
I think the very first step would be wellness checks. In a wellness check, that you also get to check, your blood pressure. You get to check your vision. You get to check your hearing, depending on how old you are. Blood pressures greater than or equal to 140/90 millimeters of mercury. That is a call for action.
Now let's talk about the thyroid function test. How important is it? You see, because I believe that there are certain symptoms that people are beginning to experience, they don't even know it's related to their thyroid functions.
So the thyroid organ in the body is a small organ that helps with body metabolism. It helps the body.
You see, and that's why this needs to be conducted periodically, so we can spot when something is beginning to go wrong.
Okay, so kidney function tests are a group of blood and urine tests that are used to evaluate how well your kidneys are working.
Tell us about screening services, Dr. Mollie.
Okay, so screening is the application of a test to detect a potential disease or a condition in an individual who has no known signs or symptoms of that disease or that condition. Cervical cancer has been noted to be one of the leading causes of death in women.
So what advice would you give to somebody who's afraid of what this screening test may reveal?
Screening doesn't give you the problem. It gives you power over the problem, especially early. Right?
Somebody said that we must all choose between two pains. You see, it's either the pain of discipline or the pain of regret.
One thing we must remember is that if screening is done too late, after the disease had advanced, after there are symptoms, after there's organ damage, many of the preventive or curative advantages are lost.
He said we are stewards, we should honor God with our body. The Bible says, know ye not that your body is the temple of the Holy Ghost.
Dr. Mena, to everyone who is listening, an ounce of prevention is worth a pound of cure.
He said, book that consult today. We can make choices, but we can't choose the consequences thereof. What choice are you making today about your health? It's a big question. The medicine of time. Hello, everyone. Welcome to another episode of Doctor's Ministry Podcast. My name is Mena. We're still considering the series, The Medicine of Time. We did last week consider exploring the science of primary prevention. Some of the things we talked about are strategies we can employ, lifestyle habits we can imbibe that can help us prevent illnesses. You see, the Bible says in the book of Proverbs chapter 22 verse 3, it says, a wise man, a prudent man foresees evil, and then he hides himself. For the simple pass on and he is punished for it. You see, so what we're trying to do is to learn, gain information, gain insight, wisdom that will help us prevent this illness. They say prevention is better than cure. It's the best form of medicine. And our guest last week said something powerful. He said preventive medicine is the wisdom of God in action. So by all means, if you have not listened to that episode, you can check on our YouTube page. You'll see it there. That's the episode last week. But grace to God, we also have Dr. Mollie here. And together we'll be talking about exploring the science of timely intervention. This is a very important conversation, and we're going to be learning, increasing our knowledge, how that certain steps we can take, actions we can trigger. Last week, our guest made a powerful statement as well. She said, if you don't make time for your wellness, you'll be forced eventually to make time for your illness. You see, we must, by wisdom, apply our hearts such that we can prevent some of these illnesses. Dr. Mollie is here again. Hello, Dr. Mollie. Good to have you once again.
Hello, Dr. Mena. Thank you so much for having me again. It's good to be here.
Yeah, Dr. Mollie, thank you so much for last week. I learned a lot. There's certain things I'm going to put into practice. Some of the things you said. Thank you. Dr. Mollie, today again, we're still considering this series, The Medicine of Time. You see, time is of the essence. Time is crucial. The Bible says in the book of Ecclesiastes 3 verse 1, so everything there's a season and a time for every purpose under heaven. You see, there are certain things we can begin to do now, and that's some of the things we'll be exploring. Dr. Mollie, the science of timely intervention, what comes to mind first?
Thank you so much, Dr. Mena. Timely intervention. So in healthcare, it's not only what we do that matters, but when we do it. The difference between prevention and crisis, wellness and disease, often lies in the timeliness of our interventions. The science of timely intervention reminds us that early detection, proactive screening, preventive care generally, it can alter the trajectory of any illness long before the symptoms appear. Every preventive measure is a moment seized before the clock runs out. It's a deliberate act of not just giving years to your life, but life to your years. So we cannot overemphasize this issue of timely intervention, doing things when things are supposed to be done.
Well, thank you so much for that. Again, you resounded last week. You said if you don't make time for your wellness, you will eventually be forced to make time for your illness. So what you're saying is there are things we can do now. We're taking a step further. Last week we talked about lifestyle modifications, health promotion, dietary modifications, smoking cessation, all of that. Now we're taking it a bit further to some of the things that we can do. You see, and in this concept of time intervention, I think we will be looking at wellness checks and then screening exercises. You see, we want to learn. I want us to start the conversation. What are the strategies for timely intervention?
Thank you, Dr. Mena. I think the very first step would be, like you mentioned, wellness checks. There are a lot of people who go months and years on end without ever having to visit, their primary care physician to say, I've come in for what we call a checkup. Some people will say an annual checkup. Some people will say, biannually. There are different schools of thoughts about how often these things need to be done. But the point we are trying to make here is it needs to be done at some point or another. You need to visit your doctor for a wellness check. Now, when we say wellness checks, what are these things that are expected to be done or carried out on this individual that comes for a wellness check? We'll start from your weight, your height, so that we can calculate what the BMI is and, be able to categorize. Are you underweight? Are you normal weight? Are you overweight? Are you obese? Is that the first step we're going to start, talking about? In a wellness check that you also get to check, your blood pressure. You get to check your vision. You get to check your hearing, depending on how old you are, I would like to also state here that wellness checks are very, very individualized. Right? So it depends on the individual that's coming in, depending on the age, depending on the gender of this individual, that will determine what is being done during these wellness checks. Investigations are also a part, like blood investigations are also a part of wellness checks. Now, when we request for blood investigations, what exactly are we looking for? There are certain things that we look for depending on the individual again. So we want to know what the complete blood count is. What's the hemoglobin count for this patient rather? Is this patient anemic, right? And what is causing the anemia, and then proceed from there. We'll also like to check kidney function in an individual. We'd like to check the lipid profile. That is where we talk about cholesterol, triglycerides and all of that. We also, depending on the individual, want to check the thyroid function of this individual, right? And if it's someone who, say, takes alcohol, we'll also want to check how the liver is functioning, because some of these things are very silent, right? And they start creeping in. But when we go for wellness checks, and look into all of these things, know what our baseline is, right? Or know, are we supposed to start making some changes in our lifestyle? In a wellness check as well, we also check the HbA1c, which tells us, that number, it helps us to categorize. Am I pre-diabetic? Am I already in the diabetic range, or am I supposed to be starting medications? So all these things provide guide to the patient to say, it's time for me to start acting, or, oh no, I'm doing very well, I need to keep going on the path that I'm going right now. So that's what the wellness check is.
Thanks so much, Dr. Mollie. I want us to break it down a little bit, because you talked about weight, height, BMI, lipid profile, thyroid function test, and all that, HbA1c. What are the importance of these things, in the bid to try and simplify it for someone who is not medical or who doesn't really understand? Because sometimes when the doctor says we're doing these things, some people don't fully get it, why it is important to do it. I want you to start for BMI, for instance. How do you calculate that? And, how do you stratify it into underweight and, and all of that? And what is its importance?
Yes, Dr. Mena. So BMI is the body mass index. And how that is calculated is the weight of an individual in kilograms divided by the height measured in meters squared, right? And that will give the body mass index of that individual. And we're able to categorize based on that number what level an individual falls in. So if an individual has a BMI of less than 18.5, that individual is categorized as being underweight. Numbers between 18.5 to 24.9 puts you at normal weight. An overweight individual will be an individual between 25 to 29.9, right? That's an overweight individual. And then numbers greater than 30 are categorized as obesity. There are different classes of obesity, however. So 30 to 34.9 will be a class 1 obesity, right? And a class 2 obese individual will be between 35 to 39.9. Now, numbers equal to or greater than 40, those individuals are categorized as being morbidly obese. So that's a brief explanation of what the BMI is and how it relates to us, to individuals.
Well, yeah, thank you so much for that classification. Now, I want you to mention, touch on the importance of these, measurements like the BMI, because I know there are problems with being underweight and there are problems with being obese. You see, I like to tell people, find a way to lose weight because it transforms your health in many different ways. Do you want to touch on this? Some of these classifications, I believe they're not just numbers. They're metrics that we use in measuring the overall health of an individual. Would you just want to touch on this briefly, please?
Okay, so I believe we spoke a lot about weight in the last episode, and we spoke more about the overweight individual, what things we could do, diet, exercise, to be able to fall into the category that is normal. What people may not realize, a lot of people may not realize, is also the dangers of being underweight. There are a lot of side effects. When your BMI is less than 18.5, it affects your heart. It affects your fertility. It affects your bone health as well. So these are the ways that being underweight can affect you. So it's important, like we spoke last week, about moderation. Everything needs to be done in moderation. So you have to be a normal weight individual to enjoy good health.
So thank you so much, Dr. Mollie. Now let's talk about blood pressure, because this is one of the things you mentioned. Maybe you should just speak briefly on blood pressure and the other things that they check, the HbA1c and all of that, so people can understand what is going on and why the doctor is checking.
Okay. So for the blood pressure, there are different guidelines and categories, would I say staging for blood pressure, depending on whichever region you find yourself. To make it really simple, what I would advise is blood pressures greater than or equal to 140 over 90 millimeters of mercury. That is a call for action. That is a blood pressure that needs to be monitored more often. Right. WHO has recommended that normal blood pressure is anything 120 over 80 and below, right? To certain levels. Otherwise, it will be considered low blood pressure. But what I would say is, if your blood pressure is 140 over 80 and over 90 and above, that's a blood pressure that needs to be monitored more frequently. And you need to have more conversations with your doctor about either dietary modification, like we spoke about, the DASH diet, which is the dietary actions to stop hypertension, or medications that can help regulate the blood pressure. Now, with regards to HbA1c that I mentioned, so HbA1c is a marker that helps us calculate the level of your blood sugar over 2 to 3 months, versus just taking a pinprick and doing a blood sugar immediately that would either give us a random blood sugar or a fasting blood sugar, depending on the state of that individual. That really doesn't tell us much about the sugar control of this individual. But the HbA1c is a marker that helps us to classify properly and lets us know, okay, is this patient at risk for diabetes, or is this patient pre-diabetic, or when do we step in to start different modifications? And there are also levels to that depending on which climate you find yourself. There are guidelines for each of these numbers.
Thank you so much for that information. Now let's talk about the thyroid function test. How important is it? You see, because I believe that there are certain symptoms that people are beginning to experience, they don't even know it's related to their thyroid functions or how healthy their thyroid is. They may not know. How important is the thyroid function test?
So the thyroid organ in the body is a small organ that helps with body metabolism. It helps the body to utilize energy, and it affects various organs in the body. It affects the heart, it regulates the heart rate, it affects brain development and the bone development, skeletal development. It also affects fertility because it's a hormone, right? It releases different kinds of hormones that also, help with regulation of things like the menstruation, and things like that. So it's an important organ in the body, and it's also important to check this every once in a while because some people walk around with either hypothyroidism or hyperthyroidism, and by that I mean where the hormone is either elevated or depleted, and you come up with a constellation of symptoms that most people don't even realize, oh, this is exactly what the problem is, or this is what is going on. And because the thyroid, regulates functions across different systems of the body, you could have different symptoms, present with different symptoms, from heat or cold intolerance because it helps regulate temperature, to constipation or diarrhea because it also helps with digestion, to symptoms of infertility, like I mentioned. So someone not having their period versus having too much of a period. And so the thyroid organ is a very important organ in the body that needs to be checked, during the wellness checks.
Yeah, thank you so much. That's powerful. Now, you see, so what we're trying to say is that for every test your doctor is conducting, there's a reason for it. You see, and that's why this needs to be conducted periodically so we can spot when something is beginning to go wrong. This is important. Dr. Mollie, you also mentioned lipid profile, this is cholesterol and all that. What is the importance of this test?
So the lipid profile checks the cholesterol levels in a patient. And, like we spoke about last week, we talked about the deposition of these cholesterol plaques. And it could deposit different places, different organs of the body. It could even deposit it right down to the arteries, and it could cause a heart attack. It could cause a stroke if that plaque breaks off and goes to the brain. So knowing your cholesterol level, helps you calculate what your risk is, either for a heart attack, it helps. Once we know what those levels are, we can prevent those kind of things. So it's important every once in a while to check your cholesterol levels so that you can make dietary modifications or even get put on medications that could help prevent, the risks with elevated cholesterol levels.
Yes. Thank you very much. Now, what about kidney function test?
Okay, so kidney function tests are a group of blood and urine tests that are used to evaluate how well your kidneys are working. The kidneys are important for filtering waste from the body, balancing fluids and electrolytes, and maintaining overall balance in the body. So some of the tests that are done during a kidney function test will be things like something called the serum creatinine and the estimated glomerular filtration rate to tell us how well the kidney is filtering these things, waste products out of your body. The reason why this is important is, kidney disease is usually asymptomatic, meaning that the patient will probably not show up with any symptoms for a very long time until it has advanced really badly. So it's important to check these numbers ever so often to know where you stand, right, in terms of how well your kidneys are functioning. Another reason is that for people who are already diagnosed with high blood pressure, diabetes, and who are on medications that could affect the kidneys, it's important to also measure these numbers to see if these disease entities have already started affecting the kidneys and what steps need to be taken timely to prevent further progression of the disease. So basically that's what the kidney function test is all about.
Right, thank you so much. So I think you've itemized all the, you've mentioned all the very important tests that happen. So just to recap, you talked about the blood sugar, checking the HbA1c, which gives you an idea of your glucose control over the past 3 months.
Yeah.
Because, if you do a test now, that just tells you what's going on now. See, it depends on when you're checking it, but if you want to know how well sugar is being controlled, then that test is crucial. Then, of course, we're talking about the blood pressure, the weight, kidney function test, thyroid function test, and some of these things. There's a reason why the doctor is doing it. It just gives the doctor an idea of how well you are. Remember, you might not feel anything in your body, you might not have any pain, or you might not even be hospitalized in the hospital. What we're trying to say is timely intervention. There are things we can check and detect, that can help us either reverse the course or slow the progression. You see, so that's why this wellness check is very important. So by all means, find a way to do some checks. Some people have never been to the doctor all their life, and they say it as a matter of pride and say, well, I don't go to the hospital, I'm never sick, and blah blah blah. I mean, going to the hospital, going to see your doctor for a wellness check does not mean you don't have faith. You see, I think this is very important. Dr. Mollie, thank you so much. Now I want to talk about screening. Because screening is also a form of timely intervention, for in primary care, just to say things that we can pick on time. There are certain tests we can do that can give us an inkling as to what's going on. You see, tell us about screening services, Dr. Mollie.
Okay, so screening is the application of a test to detect a potential disease or a condition in an individual who has no known signs or symptoms of that disease or that condition. So what happens is it aims to detect a preclinical disease or risk factors for that disease, so that the interventions that we now engage in are more effective. You generally reduce mortality, morbidity around that issue, or the progression of that disease is slowed. There are a couple of screening tests that are recommended depending on, first of all, the gender and the age of that individual. So I'll start off with maybe for females. There's a screening test for breast cancer, which is a mammogram, and it's usually recommended depending on which area you live in. All different areas have different guidelines, so it's important for you to find out what the guidelines are in the area where you reside. But generally speaking, it's usually from the age of 50 to 74 years of age, where the female is subjected to something called a mammogram to detect signs of breast cancer. Now, if you do have a family history of breast cancer, you might have to undergo that test a little earlier than the general population. And that's why these wellness checks that we spoke about are important, because when you go for a wellness check, one of the things your doctor will do is take a full history, including a family history, to know what genetic conditions or what hereditary conditions you have, and be able to, propose a timely intervention for this screening test. So that's the first one for a female. The second test that a female does is something called the pap smear, or the HPV testing against cervical cancer. Cervical cancer has been noted to be one of the leading causes of death in women. And it's preventable, because if you're testing early, we're able to pick the signs early, and we're able to treat early, because it is a slow growing cancer. So that gives us, an advantage over this cancer. The test is done by taking some cells from the cervix, and it's usually recommended depending on where you reside, again, usually from age 25 to 69 or 70. And this is done every 3 to 5 years, depending on what the results say when you do the first test. So that's one test also that can be done in women. Another screening test that women can do is a screening test for colorectal cancer. And this is applicable to both men and women. And it's also from ages 50 to 74. And depending again on the region where you reside, for some regions it's as simple as something called a FIT test, where they just take a stool sample and check for occult blood in that stool. And then, if it's positive, we investigate further. For some other regions where they don't have the FIT test or an FOBT, which is a fecal occult blood test, where they test your stool, you might have to undergo a colonoscopy. And this is where a camera is inserted through your rectum to look into your intestines for any signs or changes of colorectal cancer disease. Another test that is done also in males and females will be a test for lung cancer screening. This might not be well known in other regions, but for some regions there is a test to screen against lung cancer. For those who have been smoking for a number of years, it is recommended to have a low-dose CT scan, usually from age 55 and above to about 74. And that's if you have a significant smoking history, right, to check for any changes in the lungs. Another test that is done for both male and female will be a test for osteoporosis, usually recommended over the age of 65. What is done is called a bone mineral density test. It's like an X-ray. What it does is it X-rays the bones to see if there are calcium deposits or other deposits of other minerals, to show signs of osteoporosis, and also helps to reduce the risk for a fracture in the elderly, for people older than age 65 and above. we're able to calculate that risk, and then we're able to say, okay, you're probably not, at a risk for osteoporosis yet, but it's time for you to start taking supplements like calcium, vitamin D. It's time for you to start muscle strengthening exercise. Or yes, you're at a risk for osteoporosis. We need to start you immediately on the medication to preserve your bones. And finally, one more test I'll talk about is the prostate cancer test, screening test. There are two ways to do this: the prostate specific antigen, which is a blood test, and a digital rectal exam. So it's recommended when you go as a male for your wellness checks that your family doctor or your primary care physician performs a digital rectal examination to assess the size of your prostate. Because granted, as men grow older, the size of the prostate will increase. But what we're trying to keep an eye on is this a cancerous growth versus is this just, a benign growth, which means something that is not cancerous. And for men who are of African descent, the risk is higher for prostate cancer. So when you're of African descent or you have a family history of prostate cancer, it's important that you check on this. You perform this prostate cancer screening test to be sure that you are not at risk. And even if you're at risk, something can be done early enough. Like we're saying, it's all about timely intervention for these things. So basically, that's a general overview of the screening tests that are available for different individuals based on gender and age.
Thank you so much, Dr. Mollie, for how you've presented it. So, if you're male, whether you're male or female, no one is exempted from this thing. What we're saying is that go and do a screening test. No matter who you are, no matter how old you are, there are tests we can begin to do. It is better to catch it early. You see, like we said, the Bible says a man sees danger ahead, a wise man, and then he hides himself. So these are some of the things we can recommend. And of course, if you're doing screening tests, wellness checks and all that, the things, the kind of conversation you'll be having with your doctor. These things are usually comprehensively, so it's just a tick box exercise, for these things. But it is very important we do so. Dr. Mollie, do you have any story of how these screening tests have changed or saved the life of somebody?
Yes, I have a few stories, actually, a lot of stories of how screening tests have saved different lives. I'll pick a story about a young lady who had, grown up in rural area where I reside now and had never, done anything like a pap smear. She wasn't even aware of this. And then coincidentally, she came in and she was pregnant at the time she came in. She came in for some of the complications she was having during her pregnancy, and the question was asked, if she had ever had a pap smear done, and she was not even aware that she was supposed to have a pap smear done. And this was a young lady of about, I think, 29 years old. She had been sexually active from the age of 18, so she had been exposed, to the virus for a couple of years, and she was not even aware. And so when we carried out that test, during the routine antenatal visit that she came for, we were able to pick up some cells that were precancerous at the time, and so because we were able to pick that up, we now scheduled more regular screening for her. So she had a repeat cervical pap smear in 6 months, to see what was going on. And by that, we were able to save her, from the issue of it transitioning from being just precancerous cells to full-blown cervical cancer. And she was able to have her baby as well, who was healthy. So screening tests are very important. And, the timely intervention, like we're talking about, is a very important part of screening tests. Disease often goes through stages before symptoms arise. And if a screening test picks up that disease, the treatment may be more effective, like in this case of this lady that I just spoke about, and it may be less invasive. It may prevent irreversible damage. That latent period between when that disease is picked up and when you actually become symptomatic, it may be sufficiently long enough to make, beneficial and practical changes or in the life of that individual. And also with screening tests, there might be a little bit of a bias because when we detect the disease earlier, it may appear to increase the survival time of that individual simply because the diagnosis occurred earlier, right? So that is also an advantage because we pick it up early, so we're able to, increase survival time as it is.
Yeah. So the fact that was picked on time changed the prognosis or even improve it, and then the person could live. Yes. That saved the life. Thank you so much, Dr. Mollie, for that. That's really inspiring. Now, I want to say there's some certain people that have certain myths or behavior regarding screening tests. what would you say to somebody who is afraid of what the screening might reveal? Sometimes people think that, when they don't go to the hospital, then as long as the doctor doesn't find something wrong, then they are okay. You see, there's some school of thought like that. And like I said,
Mm-hmm.
some people take pride in the fact that they've not been to the doctor before for years and years when they were born and stuff like that. Good enough. That's something that you don't have any illness or anything that takes you to the doctor. But then, I say that having this health seeking behavior can help save your life. So, what advice would you give to somebody who's afraid of what this screening test might reveal? Maybe, for instance, their dad or mom had some sort of cancer runs in the family, and they're afraid of turning up.
Okay. So, what I've noticed in my years of practice is that generally people tend to avoid tests that are either very invasive or uncomfortable, or tests that are perceived as embarrassing, or like you mentioned, an associated fear of bad news, or the stigma that comes with just knowing that, oh, this is what is going on. What I have to say is that fear of knowing is natural. People worry that a screening test, would turn your world upside down. It's better for me not to know. Or like you said previously, what I don't know will not kill me. But what I will say is that many people feel anxious before a test, and that is very human. It's normal to feel anxious. It is usually the unknown that feels scary. Screening tests or screening doesn't give you the problem. It gives you power over the problem, especially early, right? It gives you power over that problem early enough when it is still manageable. So that's the way to think about it. Most health problems start silently, and it is the screening test that lets us catch these things while we still have time to fix them early before they grow or cause damage. So if we wait until symptoms appear, we may have lost the chance, for the easier treatment, for the less invasive procedure, for the test that costs less, So instead of that, just think about it, that screening is protecting your future self. So just go ahead and do that test. It's best to know early enough.
Yeah. Thank you very much, Dr. Mollie. Now, let's talk about procrastination, because you see, certain people believe that they are too busy. You see, they work all through the year. In fact, someone told me sometime that he's never taken annual leave for the past 3 to 4 years because he's always busy. You see, now you're so busy with your job, busy even to hardly had time for family and all that, let alone seeing the doctor. You see, make a comment on this procrastination. By way of trying to inspire somebody or motivate somebody to get rid of that thing and make the time for this. If you don't prioritize it, it will never happen. You see, so please make a comment on this, Dr. Mollie.
Okay, so a wise man I spoke to once said that procrastination is the devil's tool to rob you of what you're supposed to, get now and even in the future. One thing we must remember is that if screening is done too late, after the disease had advanced, after there are symptoms, after there's organ damage, many of the preventive or curative advantages are lost. Most times it is, we can't do anything anymore about this. So the delay is dangerous in this case. That delay between when you make up your mind or when you are aware, like now, that there is a screening test for this, that to when you actually go and perform that screening test, to the time when you get a diagnostic confirmation, to the time when it is treatment is started, that delay can cause a lot. So, my advice would be time sensitive in making your decisions. Just the same way you make up your mind about signing a deal, or about, doing something else, you should make up your mind about health related issues. Take steps, to better your health while you can, because delay is dangerous.
Yes, indeed. Thank you so much. My next question would be, how can the church promote this aspect of wellness? What can the church do? What are things they can do? I know there's some ministries. I think I'm invited to his church before to do some kind of health promotion talk. Some churches schedule screening tests, screening services for their members and all that. I think that is something that everyone should imbibe. Make a comment on this, please. How can the church promote these services?
Okay, Dr. Mena, the church and preventive health. So the church is one of the most trusted and accessible community hubs. That's where we find a lot of people, have trust in their spiritual leaders, their pastors, and it plays a powerful role in promoting preventive medicine by addressing both the spiritual and physical well-being of its members. The church can teach that caring for one's body is a part of your spiritual responsibility. It's a form of stewardship of the life and the health that God has given to you. Encouraging messages on, things like honoring God with your body, promoting the idea that prevention is an act of faithfulness and not fear. Preventing disease allows us to serve longer and even live purposefully. Another way is that churches can also organize, health education and awareness, like regular health talks, workshops that focus on prevention, early detection, and lifestyle modification, and invite, local healthcare professionals or even parishioners who are physicians or nurses to come and give these talks. Another way is health fairs. I know that a few churches are involved in things like outreaches and health fairs, where they screen blood pressure, blood sugar, BMIs, and things like that. You can even dedicate a Sunday for a wellness Sunday for a theme dedication on a particular topic, things like that. Or even, in their newsletters, there can be a section, a bulletin insert on preventive topics and just reminders. Have you seen your doctor today, or things like that. Another way would be modeling healthy habits in the church. So when we gather most times in church, there's usually lots of eating and drinking, so encourage healthier meals even at church events. So more fruits, more vegetables. You can also promote physical exercise, physical activity by walking programs, fitness groups in the men's and women departments and things like that. That could also help, to provide more awareness about preventive health. And we mentioned initially that preventive health is not only physical, it also includes mental and emotional awareness. So I believe that the church can help create a safe space for discussions about stress, about depression, about burnout. It is not a sign of weakness. So if the church, can train leaders in mental health first aid, and encourage people to, take up trainings in counseling, so that people can have access to both counseling and spiritual direction when needed. These are the ways that I believe the church can, come in to help in this raise awareness about preventive health.
Yes, Dr. Mollie, you said it all. The church has a role, definitely, in this crusade. You see, this is a crusade, I'll call it, in this crusade of, timely intervention, the things we can do. We're talking about the medicine of time. There are things that we can do now that will prevent that illness, that will slow the progression of that disease. There are things we can do now. Catch that in early. Early detection can save a life. You see, like this Mollie said, we are stewards. We should honor God with our body. The Bible says, know ye not that your body is the temple of the Holy Ghost. See, so God expects us, to be stewards. God expects us to take care of our body. Because you see, so our body is important, being on this earth to fulfill God's assignment. God is counting on us to do it. God is counting on us, to live life to the very best, And like somebody said, it's no longer a thing of weakness to see the doctor. It's no longer a thing of weakness, to go for a checkup. Because growing up, we used to think that when you're sick or whatever, you hide away. You don't tell because people might think, oh, you don't have faith and stuff like that. Gone are those days. It is path of spirituality. It is path of looking after your body. You see, by doing this wellness check, by triggering this investigation, speaking things on time. Thank you so much, Dr. Mollie, for this very inspiring and informative session. I want us to round off this episode, the medicine of time, exploring the science of timely intervention. What are your final thoughts, Dr. Mollie?
My final thoughts would be this, Dr. Mena, to everyone who is listening. An ounce of prevention is worth a pound of cure. That's what somebody said. Screening is about using time wisely. And by detecting early, we borrow time from the disease and give it back to life. So take that step today. Go for your wellness check. Request for the screening test that you qualify for from your doctor. And ask for more information if you need to. It's your right for you to know, what exactly it is that is going on in your body or what is required of you at a certain time. knowledge is power. So
Yes.
go ahead
Yes.
and book that consult today. Thank you so much,
Yes.
Dr. Mena.
Yeah. Thank you so much, Dr. Mollie. It's been such a blessing having you around. We're still on the series, The Medicine of Time. There are a few other things we need to consider at a much later date. For instance, some people who already got high blood pressure, got diabetes and all that, what are the things they can still do, to slow the progression of that disease, So thank you so much. It's been such a blessing having you on this episode. The Medicine of Time. We hope we have been able to inspire somebody. We hope we'll be able to motivate somebody to say, look, make it priority. Dr. Mollie said, book that consult today. You see, whatever you don't prioritize, you ignore. You see, let your health become top of your priority list. Prioritize your health because it's part of your stewardship to God. The Bible says that in the book of Proverbs 22, verse 3, it says, a wise man sees danger ahead. You see, and he hides himself. Say, but the simple pass on and is punished for it. Somebody said that we must all choose between two pains. You see, it's either the pain of discipline or the pain of regret. See, if you don't do it now, you might regret it. You see, so choose wisely, This day, life and death is placed before you. Choose, Remember, we can make choices, but we can't choose the consequences thereof. What choice are you making today about your health? It's a big question. See, what Christian doctors and understand science, but we're saying that this is what God expects us to do. The medicine of time. Thank you everyone for joining us today. Like we said, if you've not listened to the last episode, by all means, go ahead and look at it. This information is not for you alone. Share it with your friends, share it with your parents, share it with your siblings, share it with those that you care about. Make this a point of duty to ensure that the people around you are healthy and they do the right things. You see, this is a crusade, and what we want to do is that we want to ensure that people are healthy, see their doctor on time, and prevent that disease from ultimately happening. Dr. Mollie, thank you once again for joining us. Hopefully we'll have you again sometime in the future and we'll explore this concept further. Thank you. And thank you everyone for joining us. Yeah. God bless you. And thank you everyone for joining us today. This is the Dr. Ministry podcast. We're still talking about the medicine of time. Today we've talked about exploring the science of timely intervention. Until we come your way again next time, keep living in an atmosphere of faith. God bless you. Well, thank you everyone for joining us today. We hope you've been blessed. Join us again next week. This is Doctors in Ministry. We're medical doctors and we believe in Jesus as our personal Lord and Savior who has given us life and peace. Jesus said one day, he said, come unto me, all you who are weary and are heavy laden, and I will give you rest. If you'd like to give your heart to Christ today, please lay your right hand on your chest and say this prayer after me, wherever you are. Say, Lord Jesus, I believe in you and I welcome you into my life. I believe you're the Son of God who paid the price for my sins. By faith, I receive you into my heart as my personal Lord and Savior. Today, I receive the life of Jesus Christ, and I declare that the powers of sin, Satan, hell, and the grave are broken over my life. Henceforth, I declare that my sins are forgiven. I am born again, and I'm a child of God. Amen. Well, if you just say this prayer, congratulations. I welcome you into the family of God. Kindly reach out to us. Send us an email at info@doctorsinministry.org. We'll be glad to connect with you and to share resources with you that will help you grow your faith. Thank you again, everyone, for joining us on today's episode. Until we come your way again next time, keep living in an atmosphere of faith. God bless you. Thank you.